They, of course, provide a pool for future more mutations. We have the means to, if not eradicate, greatly control and diminish the harm caused by uh, uh, the coronavirus infections, and also to prevent, at least to limit, the possible mutations, which could be much more harmful than what exists now. The means exist, but they have to be followed. If they're not followed, there'll be more suffering, more pain, more deaths, more crushing of hospitals. Many hospitals have literally had to suspend normal operations just because of the overflow of largely unvaccinated patients are filling up the COVID wards. In a minor way, I even experienced that myself, but it's been serious. So I think it's a major problem. There's a lot to do. There's more to say about this. It's critically important to get vaccination advanced in the large regions of the world which have not had access to vaccines or only limited access. The rich countries, Europe and the United States, in the early part of this plague have tended to monopolize the vaccines for themselves. Actually, the European record is worse than the US record in this. Biden administration has taken some steps to try to break through the monopolization, large part of which incidentally goes back to the World Trade Organization rules that I mentioned earlier, which provide, those are called free trade agreements, but they're not free trade. They provide extreme protectionist measures to ensure very high profits for pharmaceutical corporations, for mega media corporations and others, what are called intellectual property rights, exorbitant patent rights, which allow them to way overcharge and make extraordinary profits, even though, in this case of the pharmaceutical industry, as much of the research and development is actually done at public expense, including the Moderna vaccine. But the rules of the mislabeled free trade agreements allow them to have basically monopoly pricing rights. Well, the Germans have been even more adamant in protecting this than we have. But the effect has been to deprive large parts of the world of the vaccines that they need. This is a threat to us as well, not just to them. It means, again, a large pool of unvaccinated people, which provide the virus opportunities to mutate as it does rapidly, and nobody knows what the next variant might be. We've so far been kind of lucky in that the variants that have appeared over the years have either been highly lethal but not very contagious, like Ebola, or highly contagious but not very lethal, like Omicron. Can't guarantee that that'll continue. Well, the point is, going back to what I said before, the question is, what can we do? Well, what we can do is apply the means that are available: intensive vaccination, protected spaces for people who want to be safe from infection, distancing, masks, many mechanisms that can be used to reduce the spread of infection and to ameliorate the crisis, largely overcome it. So we have to pursue those measures. Florida, under DeSantis, does not have a good record on this.
Jim's in Caliente, California, and Jim, you're on with Noam Chomsky.